If this is your first time, I'll tell you a little bit about Migraine and Headache Australia. We are a division of the Brain Foundation, and our mission is really threefold. We want to provide trustworthy and reliable information, and we do that through a range of different tools and resources, such as this webinar, and as well as articles on our website that are medically reviewed. We also fund research, and we try to fund at least one research project into migraine and/or headache each year. And we advocate and support people living with headache and migraine disease. Throughout the week, throughout Migraine Headache Awareness Week, we're going to be highlighting some of the different things that we've been doing this year. But we'll be just highlighting one at a time because we could make a whole presentation out of all of that. And I know that you want to hear from our expert speaker very soon. So just to pick one of the items, the first item that we'll cover off is media. And this year we've had quite a response from media and quite a few different media appearances since January. And one of them was featuring on the SBS program called Insight, where they did a segment or an episode about invisible illness. And they spoke about a range of different conditions as well as migraine. And we were able to talk about migraine, and we even had someone from our community who was a doctor who had to retire from her profession because of migraine, and she featured in the program as well. We were interviewed on Channel 9 about new research that linked some of the GLP-1-like treatments to reductions in migraine, interestingly, beyond the connection between weight loss. And so we spoke to the press about that. And most recently, and the purpose for tonight, is around the research that we did in partnership with Jean Hales for Women's Health. And so you can see in the red, Dr. Sarah White, who's the CEO of Jean Hales, speaking to the press in a panel and also being interviewed on Channel 7 as well. And we got a range of media coverage that was absolutely fantastic. And we'll hear about what that research was about tonight from someone from Jean Hales. And we also have Kate May featured below with her puppy, the brown puppy down below, the black puppy down below. And she was a wonderful advocate and spokesperson from that research too. So we've been busy. There's been lots happening, and hopefully you've been able to sort of follow along. If you follow us on social media or on emails or LinkedIn, you'd be seeing some of this. I'd like to thank our event sponsors, AbbVie, Pfizer, the Brain Foundation, and Lumbeck. Without their support, this would be a very difficult event to do, and we wouldn't reach nearly as many people. Now, you are in the right place if you have migraine or headache. You might be a parent, partner, or caregiver. You don't need to have migraine or headache yourself. You may want to connect with other people like yourself, or you might want to ask a question. If you tick any of those boxes, you are in the right place. Welcome. And I'll just lastly let you know about our free peer support group, which is held on Facebook. I know it may not be your favorite network, but the group is a thriving group with several thousand members, and it's just a great place if you need to bounce off other people. But please note that we don't, there's no medical advice. We don't have doctors that are responding to questions. It's really just the community for the community. So use it for that purpose. And again, if you've got questions, let us know. If you've got reactions, we encourage you to use those generously as well. So thank you for that. Now, on to our speaker, Dr. Hayley Guiney. She is the head of evidence and insights at Jean Hales for Women's Health, where she leads the National Women's Health Survey and a range of different research and evaluations projects that are used to inform national policy, health programs, community initiatives, and even partnerships like the one with Migraine and Headache Australia and the Brain Foundation. She's been doing it for a long time, for 15 years, across government departments, academic settings, NGOs. So she brings a deep level of knowledge and expertise and applies that from a psychology background into public health to help shape policies and interventions that at the end of the day help us live healthier and better lives. So I'd like to thank Hayley.
Thanks very much for the introduction, Carl, and great to have everyone on the call this evening. So before we get started, I would just like to acknowledge the traditional owners and custodians of country throughout Australia and their continuing connection to land, waters, and culture. I'd also like to pay respect to elders, past and present. Okay, so the first thing I was going to talk to you about today is migraine prevalence. So just how common is migraine in Australia? So we know that migraine is one of the leading causes of disability around the world, and we also know that it's much more common in women than it is in men. But actually, we have really little national data on just how common migraine is in Australia. We have some information gathered from medical records or some smaller studies, but we don't really have a good nationally representative survey to tell us how many people in Australia might be experiencing migraine. So at Jean Hales for Women's Health, we run a national women's health survey every year. So with that survey, we invite over 3,600 women across Australia to answer questions about different aspects of their health. And in 2025, we decided to focus on migraine because we know that there's this big data gap. We know that it's a big health issue, but don't have good statistics on just how common it is here in Australia. So that survey is conducted with women aged 18 years and over, and gives us really good insight into what's happening for women's health in Australia. So what we found is that there were a surprisingly high figure. 1 in 3 women in Australia have been diagnosed with migraine in their lifetime. And so that's around 30% of women. A surprising figure, given that migraine's not really talked about all that much in the public discourse, but obviously a serious health condition. But we also know that not everyone who experiences migraine will have received a diagnosis in their lifetime. So what I'm showing you here, that blue circle represents the 30% of women who have received a diagnosis in their lifetime. And that breaks down into 13% of women who have been diagnosed with migraine, 13% of women who have been diagnosed with migraine, but didn't actually experience a migraine in the last 3 months, 17% of women who both have a diagnosis and did experience a migraine in the last 3 months, and then another 13% of women who don't have a diagnosis, but likely did experience migraine in the last 3 months. So that 13% is on top of those 30% of women who are living with migraine. Again, we can see this is having a really big impact for women in Australia. So we also know that from other research internationally that migraine is more common for women in their 30s and 40s. We see this really clear age difference. And so we saw the same thing in our data, that for women aged 45 and younger, 4 in 10 women were reporting experiencing a migraine recently. And then that number gradually decreases as women get older. So for women aged 45 to 64, there were 2 in 10 women who experienced a migraine in the last 3 months. And for women aged 65 and over, it was 1 in 10 women. So we don't know exactly what causes migraine, but we do know that hormonal fluctuations, things like estrogen changing over your menstrual cycle, can have an impact. Also things like stress, lack of sleep, and diet can all play a role in people experiencing migraine. And we know that those factors all change across a woman's life. And many of those things might be reaching a peak in those age range 30s and 40s, where migraine is most common. So we saw that same pattern in our data there. So as I mentioned earlier, we know that migraine is more than twice as common among women than it is among men. And so we also wanted to see, were women in Australia aware of this? We asked them a few questions to kind of test their awareness of the gender difference. And we found that only 28% of women in Australia were aware that migraine is more common in women. So there's a clear need there for some awareness raising for people to understand that there are these very clear gender differences in migraine experience. The next thing we wanted to understand was whether women had ever sought medical help for headaches. So we kept it broad because we know that some people aren't necessarily aware of what a migraine is. So we just asked women, have you ever sought medical help for headaches? And we found that 36% of women said that they had. And that figure rises to 42% of women aged 25 to 44. And that lines up with the age range when we know that migraine is most prevalent. So we can see that women are reaching out, trying to get help and support for the headaches or migraine that they're experiencing. And I'm sure this reflects the experience of some people in the call. We found that the women often talk about experiencing delays to diagnosis or having trouble being diagnosed with migraine. And so we did see that younger women, aged 18 to 24, even though they're seeking help in similar numbers to women in other age groups, they were much less likely to have a diagnosis of migraine. So perhaps reflecting the challenge in getting a clear diagnosis there, and people needing to keep going back in order to get that diagnosis. Okay, so I've given you some of the facts and figures about migraine in Australia, some of the hard statistics, but of course, to understand a health condition, it's really important to also understand women's own experiences of the condition, to hear from people who live with it day to day, so that we can really understand the impact of the condition. So we partnered with Migraine and Headache Australia to do a project with women who have been diagnosed with migraine, to really try and understand their experiences more. So Migraine and Headache Australia helped with their expertise and experience and really helped us connect into the migraine community. So we got a really good response to this project. So what we did is we wanted to look at women's experiences of living with migraine and also their journey to diagnosis. And we did this by doing a targeted survey, an online survey with over 1,200 women in Australia who have been diagnosed with migraine. And then we also did some follow-up focus groups to get some more in-depth insights to hear about women's experiences. And, you know, through the recruitment of this project, we really realized there's a strong need for women with migraine to have their voices heard. So as a researcher, we're often struggling to get people to participate in our research projects, really trying to find ways, how we're going to find people and how we're going to encourage people to participate. But actually, we saw a massive response from women with migraine that were really keen to participate in this work. And that's a real testament to Migraine and Headache Australia's community networks, and also just showing that women with migraine really want to feel heard. We had so many people say that they wanted to participate in the focus groups. It was really an impressive and an overwhelming response. So that really showed us that there's a clear need for us to do research in this space. So one of the really key themes that came out through this work asking women with migraine about their experiences is just the significant impact on people's lives. So women talked about the impact on their work, their physical health, their mental health, their relationships, and their confidence and self-esteem. So it was really across lots of domains of people's lives that they were feeling that migraine was having an impact. It wasn't just a physical health condition or a mental health condition. It had all these flow-on effects through people's lives. And so these impacts were mentioned by almost everyone who was experiencing migraine, particularly the work, physical health and mental health impacts. There were over 8 in 10 women who were saying that those things were impacted by their experience of migraine. And we had one participant who summed this up really nicely with, well, not nicely, but really concisely, is that she said to us that every part of her life had been impacted by migraine. So it really shows that the flow-on effects of the condition. Another key theme that came out from this work was women's feelings of isolation. So both during a migraine attack, feeling perhaps that you don't have the support and help that you need, but also in the wider context of managing a chronic condition. So women talked about migraine making it harder to plan and attend social activities, not knowing if they're going to be able to attend, and so hanging back a little bit, and also finding that other people were responding to them reporting migraine in the past and starting to invite them to fewer social activities. So one of the participants described her experience as basically becoming a recluse. She was saying that people didn't invite her to things because she usually doesn't make it due to what other people consider just a headache. And so that taps into the next kind of theme of the stigma and dismissive attitudes around migraine. So many women were reporting that they had experienced dismissive attitudes from lots of different people. So health professionals when they were out seeking help, their colleagues perhaps not being sympathetic to needing time off work or a different working schedule, when they were at school feeling like their teachers weren't taking them seriously, and also sometimes family members. So again, that stigma and the dismissive attitudes that women might experience contributed to their feelings of isolation and disconnection from the kind of wider social fabric. So a woman captured this experience quite well by saying throughout her life, her migraine disorder has often been dismissed as just stress or psychological, implying that it's not a real condition, it's just kind of in her head. Women also talked about the significant emotional impact of living with migraine. So the impact of having frequent pain, your daily activities being disrupted, and that impacting on your quality of life, feeling like you're not able to live your best life. And so one woman really tapped into this idea by saying, enough of her days are taken up with the headache itself. I don't want to give my good days or times to the headache too. So she was saying that there's a lot of need to do her own researching and understand the condition. And she felt she had such few good days or days when she didn't feel unwell that she didn't want to then give away those days to finding out about migraine. I think that really taps into the kind of emotional impact that some women are experiencing with migraine. On a slightly more positive note, women did talk about the importance of social support from their family members and friends, that being a really key support for them in helping to manage their condition and also to reduce the impact on the other aspects of their lives. And particularly this was from women, the support was most valuable from women who experienced migraine themselves. So they could share information with each other, talk about their own experiences, feeling like your experience was legitimate, and also being able to understand each other's situation. So that social support's a really key thing for women with migraine. And then another key part of this project we wanted to understand was women's experience with diagnosis. So we asked women, how would you rate your overall experience in getting a diagnosis of migraine? And we found that 4 in 10 women said that they had a positive experience, 3 in 10 gave a neutral rating, and 3 in 10 women said that they had a negative experience. So although it's not overwhelmingly negative, it's also not overwhelmingly positive, and there's absolutely room for improvement here in terms of women feeling like the diagnostic experience was also a good one for them. So we also wanted to flesh out a bit more, try and understand women's experiences with diagnosis, not just a rating, but more about the in-depth experiences that they had. So we found that women talked about GPs often being the first point of contact when they're seeking help for migraine. And that's a really critical point of connection, because it might either open up or close down opportunities for getting a diagnosis or finding treatment that might work for you. So that was a really key interaction for women and helped to influence their whole diagnostic journey. And many women said, though, unfortunately, that they felt their GPs lacked awareness and understanding of the condition. And so that contributed to challenges in getting the diagnosis, getting to the treatment that they needed. Again, reflecting that delay. And also, unfortunately, because migraine is such a complex and challenging condition, women found that even once they had been diagnosed, they also did have challenges finding treatment that worked for them. So being able to work with their health professional to work out what was going to work for them, try different things. Several women reported challenges in that space. Women also talked about the great importance of self-advocacy, so needing to continue to ask for help, to continue to be looking for support around diagnosis and treatment for their migraine, rather than taking no for an answer, continuing to advocate for themselves in that healthcare setting. Okay, so to sum up what we've talked about today, in our nationally representative survey with looking at women in Australia, we found that 1 in 3 women in Australia live with migraine, which is a huge number of people, really, and it shows the critical importance of us having good research, good treatment, and good diagnostic processes for migraine, and also those social supports around women who might be experiencing migraine. In line with other international research, we found that women younger than 45 were most likely to be affected. And we talked about how some of those hormonal conditions, but other hormonal changes, but also other life conditions, different stresses and things as you go through life can influence the experience of women with migraine. As we heard from women, migraine can have a profound impact on a person's life across lots of different domains. It's not just restricted to the health domain, across all those social, work, economic conditions as well. GPs were the first point of contact. They play a key role in the diagnosis journey, and so it's really important that GPs know how to recognise migraine and respond to women who might be reporting the symptoms. So I think altogether we can see that there's we really need increased awareness of migraine. We need increased awareness that it is a really gendered issue, that women are much more likely to experience it, but among both health professionals and also the general public, to make sure that people with migraine get the right care and support, and also those social supports that are going to help them manage their condition and lead a good life. So as part of this project, Jean Hales has worked with Migraine and Headache Australia to produce some information about migraine for women to read and understand a bit more about the condition. And we've had really great input from lots of different subject matter experts and the migraine community. The findings that I presented today have also been reflected in that information. So we hope that can be really useful for women who might be experiencing migraine and encourage them on their journey. So you can visit the Jean Hales website there, and there's also great information on the Migraine and Headache Australia website. So thank you all for attending today, and looking forward to hearing your questions.
Thank you very much, Hayley. That was a fantastic presentation. We're going to go across now to Q&A. Before we do, I'll just introduce 2 other people that it might be worth knowing. We've got Anik Grundy from Migraine and Headache Australia and the Brain Foundation. She's our grants program manager and digital lead. She's our moderator today, so you might see her in the comments or responding to questions. And she's a fantastic resource and is behind a lot of the articles that have been written. So she knows quite a bit about migraine as well. So she's around, and feel free to say hi to her. And I haven't introduced myself, so I apologize for being so rude. I know some of you, if this is if this is not your first time, you've probably heard me present at Migraine Headache Week in the past. But I'm someone who's lived with migraine for over 30 years now, and I work with a number of different groups and advocacy efforts and coalitions to try to lift the global burden of migraine. And I'm a member of the International Headache Society. I'm founder of the Migraine World Summit, and I'm a very passionate patient advocate who tries to speak out about migraine whenever I'm given the opportunity to media or to an audience. So that's a little bit about our team and us. And just before we go to some questions, I'd just like to share some of the quotes that you told us about what life was like living with migraine. And I mean, I think that, in my personal experience, it was very isolating going through migraine, experiencing this condition that not really anyone else could see or no one really understood. And if I was to hear something like this back then, it would be, I would have found it really helpful. And so I think, having a read of some of these things that have been said, in this case about migraine, and, this quote shares that it's obviously, it's more than just a headache. It's got a wide range of symptoms. It's debilitating, it's disabling, it's serious, it's a disability. Another quote was talking about how I used to be like the perfect textbook example of what a migraine was, and then things changed, and I was not ready for that. And the last quote talks about the need for awareness around from the general public around what people with chronic migraine actually go through. Understanding there's more than just a headache, and not scoffing at what we're actually facing. So I think that sort of really spoke to us, and hopefully that tells you that you're not alone as well. We also asked people about their diagnosis experience, and one of the people here said that they had trained themselves. We found that there was, as Hayley was saying, there was quite a significant variety of experiences when visiting the doctor, and the level of understanding that a GP would have around migraine. And I'll let you kind of read the other quotes, but it kind of speaks to that part that sometimes it's just luck of the draw, and it's not as easy as just switching doctors, because if you're in a regional or remote area, you may not have access to another doctor, and so it can be difficult just trying to work with the doctor that you do have. And then lastly, before we go to Q&A, is what you said about living with migraine and how difficult it can be financially, even socially, with lost friendships. Someone saying here that it was a silent condition, that we just learned to get on with it, and the kids need to go to school, the clothes need to be washed, and it's not just the pain, but it's the other symptoms around pain, like nausea, blurred vision, fatigue, sleep difficulties, sound and light sensitivities. And I would even add to that just the psychological torment that goes along with unpredictable, debilitating, painful attacks of any type, that can cause. And it's probably no surprise that people that live with frequent migraine have higher levels of anxiety and higher levels of mental health, because of mental health issues or depression, because chronic pain is depressing, and migraine attacks can cause anxiety because they're painful and you don't know when they're going to occur, and it's like a form of torture. So hopefully you found some of that research helpful, interesting, and validating. So we'll go now to your questions. I'll just encourage you again to jump to the questions section within the webinar window. I'm going to pull those up now. I can see we've got about 30 questions, which is fantastic. And some of them might be answered by text, so keep a lookout for that. And Hayley, if you'd like to join us, thank you. Welcome back. And we'll go through some of these questions. Now, I've noticed that a lot of these questions are sort of migraine specific questions. We can't provide medical advice. I'm not a clinician. Hayley's not a medical doctor. So we'll do our best to sort of answer these. And if there are specific questions about the research with Jean Howes for women's health, that would be great for Hayley to answer. But I might just run through looking at some of the ones that have the highest level of upvotes. And I can see here that from Jen, she asked a question about, is it normal for migraine to change over time and evolve? The answer is yes, absolutely it is. It may be over a period of years, but it can evolve. And what I would say is if you get significant changes over a short period of time, that can be a red flag, and that would be a good reason to go back to the doctor. If you're getting new symptoms all of a sudden, if there's a significant or sudden change, that's when there's sort of there's action that needs to be taken. If it's a slow, gradual thing, that's sort of different. If it's evolving over a period of years, then that's kind of normal. So I hope that helps, Jen. Natalie had a question about what the best course of action is for chronic migraine. You're having at least 15 per month. The best course of action is to have a robust and comprehensive migraine management plan. Now, I wish I could tell you what that looked like for you individually, Natalie, but it's going to vary. It's going to vary by individual. It's going to vary based on your health record, your medical profile, your health profile, your medical background. You might be allergic to certain treatments. You might respond really well to one type of treatment that someone else doesn't respond well to. But it's really about looking at all aspects of your health and well-being, and the things that you can control, like the lifestyle and behavioral factors. So things like sleep, level of movement, how much processed food you consume or don't consume, any gaps that might require supplementation, hydration, things like that as well. We had a question here about whether 80-year-olds were covered in the research. Hayley, did you, you might have seen that question. I don't think we excluded them, but can you provide more light on that?
Yes, we didn't have an upper limit on our age range, so we just invited women aged 18 and over, and in kind of proportions of age groups that are representative of the Australian population. So we had women up to age 91, I think was the oldest, but it wasn't a cut-off. It was just people aged 18 and over.
And there was a question about whether we included girls under 18.
No, not for this survey. This was for adult women, so it was women aged 18 and over. But that would be a great study to understand more about what's going on in childhood, because we know that's a bit an understood area for migraine at the moment.
I remember we did ask in the focus groups, we were talking to women about what their experience was, and many of them spoke about their experience as a child with migraine and how difficult it was. I think it's the fact that you're a child, it's almost like it's another barrier on top of being a woman when you talk about your pain and being believed in terms of what you're going through and not just wanting to sort of skip school or get out of something.
Yes, yeah, we definitely heard women talking about their teachers, being one of the dismissive groups of people who are kind of saying, oh, that's not really a real thing. Like you say, perhaps is trying to get out of school rather than actually a serious thing that people are experiencing. So we did see that come through.
We had a question about can migraine be covered for NDIS financial support? So NDIS refers to the National Disability Insurance Scheme. And from what I understand, migraine isn't covered at all on the NDIS. Even if you have the most severe type of migraine, what I have heard happen to some individuals is where there are other conditions that may be related to migraine or worsened by migraine, they've received coverage for. And these could be things, and I guess don't quote me on this, but other comorbid conditions, things like fibromyalgia, other pain conditions, inflammatory pain conditions, and mental health conditions potentially. But I'm not an expert on the NDIS, and I think if you are seeking coverage, you would need to work with one because it is very difficult. They intentionally make it very difficult to get coverage, and I think there is a real case for people with severe chronic migraine to warrant coverage, and it's just one of those issues that we need to better advocate for and to persist on. The government are going to really fight us on it because they're trying to limit their costs of it. So, yeah, it's a challenge, but it's not something that we're sort of. It's something that we are aware of, and it needs addressing. We had a question here from Kath. Do we have a list of neurologists that have shown an interest? Yeah, so yes, we do have a doctor directory on our website. And Anik, our moderator, might be able to put the link for that in the chat. If you search Doctor Directory on Migraine and Headache Australia on our website, you'll be able to find it. And we are seeking to do an equivalent list for GPs, but it's very early stages because we don't have a list of all the GPs in Australia who are interested. And so we are gradually putting the call out there to the GPs that we are in touch with to get them onto the list. But that is a great suggestion, Kath. Thank you. Hayley, was there anything that you saw coming through the questions or as you thought about the presentation that you would add to, like, any additional comments?
No, I don't think so. I think, it's just really clear just how much of an impact migraine has on people. And I know that people who themselves experience it know this already, but being able to see that in a survey that was just a nationally representative survey, it wasn't specifically about migraine. So it's asking a sample of, a representative sample of women what their experiences are, we're really seeing a huge number of Australians that are experiencing it. For me, I don't have any, I have not researched migraine before. I've done lots of other surveys and things like that to try to understand how common things are or what people's experiences might be. But this was really eye-opening for me specifically to understand just how much of an impact this is having for women. And across all different domains of people's lives as well. You know, it's not just the physical health, it's not just the mental health, it's that whole kind of confluence of things that's coming together and making it a real challenge for people. So, yeah, I think that came through really clearly in the research.
I think one of the brilliant things that Jean Howes for Women's Health did was include the GP screening questions for migraine in the National Health Research Survey. So there were, I think it was over 4,000 women in Australia that did this survey, and it's across a range of different things. It wasn't just about migraine, but it was the largest survey of that kind that actually had these questions in it where the individual didn't need to know that the individual woman didn't need to know whether she'd had a diagnosis or not. She could answer 3 simple questions, and through this screening tool, was able to get something like a 97% accurate likelihood of migraine or not. So it's not perfect, but over the population of 4,000, you can get a very accurate picture. And we found that the number of women with migraine in Australia was 30% when we previously thought it was 20. So it's another half, 50% more women than first thought, and one of the highest anywhere in the developed world.
Yeah, you're right. That was a real great aspect of the way that we did the survey. We both asked who had been diagnosed and also just those experience questions that inform the migraine screener. That gives us kind of both sides of the picture. It's not just those who already are engaging with or have received a diagnosis, but those who are just experiencing the symptoms and may have it, but perhaps aren't aware of it yet or aren't able to get that diagnosis. So it was great to be able to look at it in both those ways.
Yeah. I saw a question about did the study cover sort of preventative strategies for migraine? And for the audience, if you're looking for research relating to new treatments and potentially even treatment combinations, that's what we're covering tomorrow night with Dr. Emma Foster, who's a headache specialist and neurologist. So we're going to be going deep into different types of treatments, preventive strategies, even combinations, and looking at the latest best practices and research in that space. So you'll definitely get what you're looking for tomorrow night with Dr. Foster. Just coming back to the questions, I can see there's more questions coming in, so I'll go through and try to answer a couple of these and throw any to you, Hayley, that might relate to the research. SPD, sensory processing disorder. This is a relatively new term that's gaining sort of traction within the medical community. And if you look at the definition of what is a sensory processing disorder, migraine kind of ticks the box. And there are studies that show that people with migraine have higher prevalences of neurodivergent disorders. So yes, I would agree with that statement. But we don't have a huge amount of evidence around sensory processing disorders or the exact details. We don't know if it's causal or if it's relational. So we don't know if migraine causes that or if migraine just happens to occur in those people more frequently. But it's an interesting space that is emerging. Absolutely. Why do smells like perfume trigger migraine? This is a really interesting question. I think it helps to think of migraine in some respects as a malfunction of the brain. It's an overreactive response to otherwise normal stimuli. You could ask the same question about why does a storm or lightning trigger migraine? These are things that we encounter in our day-to-day life, and it's just an overreactive or a hyper-responsive reaction to what is otherwise normal stimuli. The good news is that as you are able to calm the nervous system or build your threshold, whether that's through natural or medical or your migraine management plan overall, then things like the weather or perfumes don't necessarily have to be a trigger, at least all by themselves. You can develop that sort of shield that allows you to walk into the office or walk past a group of smokers outside of the building and not have that headache or not have that migraine attack develop when you have that sort of robust plan that is working for you. All right, looking at the next question here. So, is there medication that you can take regularly that helps with migraine and sleep? So, I know that we're going to be talking, we've got an expert who's talking about complementary treatments and therapies on Wednesday at 11 a.m. Australian Eastern Standard Time. And in that presentation, the headache specialist, Dr. Fred Cohen, talks about melatonin. And he would be an excellent person to ask, as well as Dr. Foster tomorrow night, about medications that can help with migraine and sleep. Melatonin is an interesting one. There is some evidence to suggest that it might be helpful in the setting of migraine. And I've heard mixed reports as to whether you can take melatonin on a regular basis or not. So let's ask the doctors tomorrow. But there are other medications that do make you drowsy. And that can be a good thing and can be a bad thing. It's a bad thing if you need to take that medication in the morning, but it might be helpful if you're having trouble sleeping or migraine wakes you up. So those are the things to talk about with your doctor and figure out what is going to be best for your situation. All right, next question about from Bernadette about Nurtec. So Nurtec is a new generation migraine treatment from the class called GPANTs. This is an exciting treatment because it can be used both as an acute medication, so taken when you have a migraine attack, as well as a preventive medication. So you can kind of take it when you have a migraine, or you can take it every second day to help prevent migraines from occurring. And it works in both contexts. And it's not a medication that is linked to medication overuse headache, which can occur with other types of medications, such as triptans, for example, or opioids. So that's a very exciting treatment. And it was presented to the PBS, the Pharmaceutical Benefits Scheme, and it's been going sort of back and forth between the government or the department and the manufacturer to try and agree on the conditions for adding it to the PBS. Those discussions are still ongoing, to my understanding. I don't know. It hasn't been sort of added to the PBS, and I don't know the time frame for when it will. It's available on private pay at the moment, but it is expensive because it's not on the PBS. Hayley, are there any questions here that you would like to answer? I'm kind of hogging the microphone here, but feel free to if there's anything here that you'd like to jump in on and respond to.
Yeah, no, that's okay. So I have seen a few questions. Maybe this crosses across a few about, what happens next, or is there going to be a follow-up survey? What are we doing in response to this? So for the survey itself, it's a survey that we run every year, and usually what we do is we change the topics each year so that we can focus on filling a really key data gap or something that really needs to be addressed at that time. So normally we would do, we ask a topic like migraine and we understand a bit more about it, and then we would change our topics for next time. But I think, we also have the opportunity to think about, well, is there something we've learned about from the previous survey that we might want to follow up on in a national sample of women? And so there is an opportunity to ask more questions if there are things that we would like to understand a bit more, and if the survey is the right kind of vehicle for doing that, thinking about the experience of women in Australia. In terms of what we're doing with the information, I think one of the key things is that the information that we've gathered from the survey and also that wider migraine study that we did in collaboration with Migraine and Headache Australia was to help inform the migraine information that we've got on our Jean Hales website, so that it's not just a kind of straight telling of the evidence. It also reflects what people's experiences, what matters to them, what the key issues are. So that's one of the key places that we've that we're making sure that the survey findings are being used. And then, of course, we're going out there talking to government, talking to other groups about the findings, showing just how common migraine is, which is surprising to many people, showing how much the impact is there. And so that really helps with connecting different groups and understanding, hey, this is an issue that we should be picking up on. And I know that Migraine and Headache Australia, of course, do really great advocacy in their own right as well. So they can also be picking up the findings, sharing them in other fora, when we're thinking about looking for research funding, thinking about advocating for people with migraine. So the idea is to keep using the findings and keep sharing them out there so that we can get change for people with migraine, not just keep asking the same things and seeing that it's an issue for people. And I think I saw one other interesting question there about what are the Jean Hales stats linking endometriosis and migraine? So we don't have any statistics on this, but we do know from the evidence that people with endometriosis are more likely to experience other chronic pain conditions, migraine being one of them. So that's a really interesting link there, and I think there's a lot more research to be done in that realm. Pain is a complicated and tricky thing, and I think we can everyone can see how it's connected across our lots of different domains of our life, our physical, mental health, and how we're living our lives as well. So definitely an important field to be looking at.
Yeah, and I just added the link to the Jean Hales for Women's Health resources on migraine. It's a link, jeanhales.org.au, health-a-z//migraine. It's in the chat there. You can also Google migraine and Jean Hales Women's Health, and it will come up. Michelle Adams had a point about the training for GPs. And that was something that we almost immediately went into next. Was we realized that there's a really big piece of this puzzle, which is primary healthcare, which is where we all go typically for our when we first interact with the health system for our migraine condition. And one of the activities that we've done this year, which was shortly after this research, was train 900 GPs on migraine. And we had experts from the Australian New Zealand Headache Society come on and talk about their condition. We had a member of the leadership of the RACGP, the Royal Australian College of GPs, facilitate this webinar series to help educate GPs and do exactly what we're talking about. Now, does that mean that all of a sudden our GPs are going to be wonderful experts on the topic? I wish that would be the case, but there's still a lot more work to do. There's almost 25,000 GPs in Australia, so it's a step forward, but we need to do more, absolutely. And understanding the GP landscape, understanding they have maybe 100 conditions that they have to be across, and they don't want to miss anything that comes in that's super serious and that leads to a hospitalization or worse if they miss something in the patient. So we, on one hand, there is a lot of work to be done. There hasn't been a lot of great experiences felt by the majority of people in our community with GPs. But at the same time, they've got a lot to manage. They've got huge time pressures, and the more what we understand about migraine, which I'm speaking to the choir here about that, but the more we understand, the better chances we have in getting sort of good outcomes, good results, and having a good conversation with our healthcare provider.
Yeah, and just following up on that, Carl, as well, as part of the work at Jean Hales, we're also always thinking about that connection between women and GPs as well. So that's another key audience that we've been sharing the findings from this research with, helping to make them a bit more aware about some of the issues that they need to think about and ask about, and also providing some of those tools that women can, like symptom diaries and other tools like that women can take with them to their GP appointment, to try and facilitate their conversation, to try and convey a bit more about their specific experience rather than trying to kind of implore them on the spot. You've got the kind of data there to back you up and to show what your experience is. So there's some great pragmatic tools for women to use as well when they're engaging with their health professionals.
Yeah. And speaking of tools and resources, you mentioned a diary, And Sue asked a question about, how could we get access to specific medications as quickly as possible? The current pathway can take a long time. And I think like understanding how it works and understanding what you need to show and demonstrate. And we do have a fail first requirement to qualify for treatments like the CGRPs, for example. So to get access to those more quickly, you need to demonstrate that you've tried the other treatments and they haven't worked, that they have failed you, either due to the fact that they don't work or they have intolerable side effects, and that you've tried them for a decent period of time, or to the extent that you can't take it because the side effects are too debilitating themselves. Sometimes the cure is worse than the condition. And that you can demonstrate that with your doctor so that they can tick the box and say, yes, we have tried at least, 2 or 3 preventive therapies. This patient has chronic migraine as indicated by this diary and this record, and we've got a record of them trying these treatments. Then they are eligible on the PBS for these other medications, for example. So being organized, understanding what you need to provide, and that can be as simple as talking to the receptionist at your doctor. You may not even need to go to the doctor and have an expensive visit if you're seeing a neurologist or a headache specialist. You might be able to speak to the reception and ask them what they need, what they would ask you for, so that you can prepare in advance, perhaps while you're on their waiting list, for example. So that can save you a bunch of time. We'll just do a couple more questions now because I know we're coming up to the hour. But this has been fantastic. We've had over almost 80 questions from the audience and lots of comments. So thank you very much. We really appreciate your attention and engagement. We are going to be having more talks later this week that will be more medically based, and we'll have headache specialists and neurologists on here. So I won't answer too many more questions that are outside of my expertise, but there is one here from an anonymous attendee talking about ER doctors, and that's another great example of an area that needs research and probably almost certainly needs some specialist training for. So we talked about GPs. There's tens of thousands of those. There's still thousands of ER doctors that could benefit from training in migraine. And we know that the emergency room is one of the worst places to go with a migraine because you just sit there for hours. You're in bright fluorescent light. You're surrounded by people who may be sick and contagious or themselves are in really bad shape. And you tend to be triaged as one of the latest, you're the last person to sort of go in after you've been there only, for 4, 6, 8, 10 or longer hours. So it's really an awful place to be. And so, that is an area that ER can really help us with, but also knowing how to avoid the ER and speaking to your doctor about a rescue medication, for example, that you could use when your normal medication doesn't work. Or if they can write you a letter that you can hand into ER to say, hey, this is a patient I see. They've been diagnosed with migraine or chronic migraine. Sometimes it's refractory. This is what they'll respond to. This is what they need. That can be really helpful as well, going in with that note to the hospital. Hayley, I'd love to give you the chance just to close tonight with any sort of final thoughts or comments based on the research or from any of the comments that you've seen from the community.
Yeah, well, I guess the main thing that I want to say is thank you to everyone who participated in both the national survey and also the project that we did specifically with women diagnosed with migraine. I think, people were so, as I mentioned in my talk, were so responsive, so keen to participate, so generous in the time that they gave and sharing their own quite personal, quite challenging circumstances. And so I think that really was invaluable and really helpful to many other people who are experiencing migraine and also out there in the wider world for us to be raising this awareness in the different groups that we need to and making sure that we can actually take action. So yeah, a massive thank you to everyone who participated back, basically. And then, of course, the people at Gene Hales who have all made this work happen. I think that's been a great team effort of people with different expertise, getting that health information together, understanding the research side of things, working on that partnership activities with lots of different organisations, including Migraine and Headache Australia. So I think, it's been a great collaborative effort, and I think it's really bearing fruit already, and we look forward to seeing where the findings and the information that we gathered can go from here.
One thing I should have said in the media coverage was that due to the partnership with Jean House Women's Health, with you and your team, we reached something like 7 million people, which was largely due to your efforts. And that only came about through the partnership that we had, which has just been absolutely fantastic. So a big thank you to Jean House. You're wonderful partners. We look forward to what comes next, and I'm sure there will be some things coming next. And thank you again for tonight, for your wonderful presentation, for those insights, and for really shedding light and bringing out sort of migraine from what we thought was the case. We now know is actually it's a lot bigger, and it gives us a platform on which we can go to government and to the external community about. So thank you very much. Tomorrow we've got another speaker, Dr. Emma Foster, talking about treatments and treatment strategies and even combinations of treatments. So please don't miss out for that. If you'd like to ask her a question, she'll be on and answering questions as well as doing a presentation. That'll be same time tomorrow night, and we hope to see you there. But for now, good night